Dr. Jennifer Layden was the Director of Public Health Data, Surveillance, and Technology. Dr. Layden, thanks for being with us. And what have the last 48 hours been like for you?
Yeah, no, thanks. And thanks for having me on. As mentioned, I resigned actually on Tuesday before the events of Wednesday unfolded. And, it's been tough, but it's been tough for 6 to 9 months. Public health is so vital to our country, not just at the national level, but the state and city level as well. And it's really hard to watch public health not be able to be effective right now.
And so I know that this came for you on Tuesday. What was the defining moment where you made the decision to resign?
Yeah, so there wasn't one defining moment for me. For me, I was really optimistic that we could continue to improve the public health infrastructure across our nation. We certainly all recognize that we've had a lack of funding to public health over many decades. And over the last 5 years, we've seen tremendous progress, largely thanks to federal investments that started about 5 years ago. I was hopeful that we could continue that work, but over the last 6 to 9 months, especially with losing up to 30% of my staff, not able to execute contracts, not be able to hire new individuals, it became apparent that I was not going to be able to be effective in my role.
So explain to our viewers what your role was exactly at the CDC and how critical you believe it was to public health.
Yeah, so data drives what we do in public health. Data is what helps us to identify an outbreak, whether it's a COVID outbreak, a pandemic, or it's as simple as a foodborne outbreak. These are things that once we detect them, then public health and others go in and stop those and preventing other individuals from becoming sick. To do that, we need access to data. And so the data modernization effort was about making sure that the data flows more rapidly, seamlessly, securely, and fast to public health so that we could identify threats, shut them down, but that we can also then share that information with the public. And we've seen such tremendous progress over the last 5 years, and I'm just heartened to think that that may go away.
Here's what Chief Medical Officer, who also resigned yesterday, Dr. Deborah Owry, told me about her concerns. Let's take a listen.
CDC is in trouble. Public health is in trouble. We need people to pay attention. We're not going to be prepared for another outbreak should it happen. We can't prevent chronic diseases in communities because we don't have the resources anymore.
So do you agree with Dr. Owry? What does all of this mean?
Yeah, so I can speak to my own experience, not only at the federal level, but I actually worked at the state and city level. I was the chief medical officer, and on a daily basis, I was in contact with CDC. I needed their expertise, their subject matter perspective, whether I was dealing with a measles outbreak, a COVID, a Legionella outbreak. To lose that capability not only hurts our nation, but it hurts our state and local partners as well.
What is your reaction to Susan Menarez's firing, and do you have an opinion on Jim O'Neill being installed to run the agency?
Yeah, so I applaud Susan for what she tried to do and what she's tried to stand up for. There is a void right now in leadership. I'm glad that they've named someone, and I give them the best of luck to try to bring some stability to our nation's public health agency.
Just give us a tangible example about how you think some of this turmoil will impact Americans.
Yeah, so we rely on public health for things we don't think of on a day-to-day basis. Foodborne outbreaks, right? Public health does the behind-the-scenes work to identify those outbreaks, shut them down, prevent other individuals from becoming sick. And if we don't continue to invest in our public health infrastructure at the national level and the jurisdictional level, we will have delays in that data coming to public health, and then public health being delayed in their ability to share that information to the public.
Yeah, I think what's been missing from this conversation, obviously we've been talking a lot about all of these exits from the top of the CDC, but how this actually impacts Americans is as important. So what is your message to Americans who are concerned about where to get trusted information now about public health? Where should they be looking, in your opinion?
Yeah, so I mean, as someone who, for individuals, they should always seek advice from their clinical provider, if that's important. State and local are the front line of public health, and I would encourage individuals to become familiar with who those individuals are, those entities, because they can provide resources as well and information.